In today's lecture, we will focus on Alport syndrome, a genetic disorder affecting the kidneys with extrarenal manifestations. We will cover its introduction, genetics, pathophysiology, clinical manifestations, diagnosis, management, complications, genetic counseling, prognosis, novel therapies, patient education, and supportive care. Alport syndrome is an inherited disorder that primarily affects the kidneys but can also impact other organs such as the ears and eyes. It is caused by mutations in genes encoding type 4 collagen, a crucial component of the basement membrane of various tissues. The most commonly affected genes in Alport syndrome are COL4A3, COL4A4, and COL4A5. These mutations lead to the abnormal structure and function of the basement membrane, resulting in progressive renal damage. Alport syndrome follows an X-linked pattern of inheritance in approximately 80% of cases. This means that the disease is more commonly seen in males, who have one X chromosome, while females with two X chromosomes may exhibit milder symptoms. However, autosomal recessive and autosomal dominant forms of Alport syndrome can also occur, albeit less frequently. Genetic testing plays a crucial role in the diagnosis and management of Alport syndrome, as it enables early identification of affected individuals and allows for appropriate genetic counseling. The pathophysiology of Alport syndrome revolves around the abnormality in collagen 4, specifically the alpha 3, alpha 4, and alpha 5 chains. These structural abnormalities lead to disturbances in the basement membrane, affecting the glomerular filtration barrier in the kidneys. Gradually, this results in glomerulosclerosis, tubulointerstitial fibrosis, and progressive loss of renal function. In addition, the abnormal basement membrane can also affect the cochlea in the inner ear and the lens of the eye, causing hearing loss and eye abnormalities, respectively. Alport syndrome can present with varying symptoms, including blood and protein in urine, family history of kidney disease, hearing impairment, and eye abnormalities. Disease progression and severity can be influenced by specific mutations, leading to end-stage renal disease in some patients. The diagnosis of Alport syndrome involves a combination of clinical features, family history, and specialized tests. The presence of hematuria, proteinuria, hearing loss, and compatible family history, along with characteristic histological findings on kidney biopsy, may raise suspicion for Alport syndrome. Genetic testing, including sequencing and deletion/duplication analysis of COL4A3, COL4A4, and COL4A5 genes, can confirm the diagnosis. Additionally, other tests such as audiometry and ophthalmic examination can aid in the identification of extrarenal manifestations. The management of Alport syndrome primarily focuses on supportive care to preserve kidney function and prevent complications. This includes strict blood pressure control, proteinuria management with angiotensin-converting enzyme inhibitors, ACEs, or angiotensin receptor blockers, ARBs, and the avoidance of nephrotoxic medications. Regular monitoring of renal function, audiometry, and ophthalmological assessments are essential. For patients with ESRD, renal replacement therapy in the form of renal transplantation or dialysis may be required. Additionally, ongoing research is exploring potential novel therapeutic interventions targeting the underlying genetic defects and renal fibrosis. As Alport syndrome progresses, various renal complications can arise, contributing to the decline in kidney function. These complications include glomerulosclerosis, tubulointerstitial fibrosis, chronic kidney disease, CKD, and ultimately, ESRD. Other complications may include hypertension, electrolyte imbalances, and cardiovascular diseases. Management of these complications is crucial to delay disease progression and improve patient outcomes. Alport syndrome is not limited to renal manifestations alone, as it can also affect other parts of the body. Hearing loss is a common extrarenal manifestation, which may present as sensory neural hearing loss, starting with high-frequency loss and progressing to involve all frequencies. Ocular abnormalities, such as anterior lenticonus and retinal flex, may also be observed. Early recognition and appropriate management of these extrarenal manifestations are important in optimizing patient care. Given the genetic nature of Alport syndrome, genetic counseling plays a crucial role in providing families with essential information regarding inheritance patterns, genotype-phenotype correlations, and reproductive options. Family screening and testing are recommended to identify affected individuals and enable early intervention. Genetic counseling services can empower families and guide them in making informed decisions about family planning. Various prognostic factors influence the progression and outcomes of Alport syndrome. These factors include the specific genetic mutation involved, the age of onset of symptoms, the severity of proteinuria and hematuria, and the presence of extrarenal manifestations. Understanding these factors can aid in risk stratification and guide clinical management decisions. Advancements in research have led to the exploration of novel therapeutic approaches in Alport syndrome. Emerging treatment strategies include collagen therapies, such as the use of recombinant human type 4 collagen, and genetic therapies aimed at correcting the underlying genetic defects. Clinical trials investigating these innovative treatment modalities are ongoing, holding promising potential for improved outcomes in the future. It is crucial to provide patients with Alport syndrome and their families with comprehensive education and support. This includes information about disease progression, management strategies, genetic counseling, and available resources for emotional and social support. A multidisciplinary approach involving healthcare professionals, patient support groups, and community resources can significantly contribute to the well-being of individuals living with Alport syndrome. In summary, Alport syndrome is a complex genetic disorder that affects the kidneys, ears, and eyes. It presents diagnostic, management, and long-term challenges. Comprehensive understanding of its genetics, pathophysiology, clinical manifestations, diagnostics, treatment, complications, genetic counseling, prognostic factors, patient education, and supportive care is vital for healthcare professionals. Ongoing research offers hope for improved interventions and outcomes in Alport syndrome.